Hello and greetings from Vitalis. This is Nordic Healthcare Group's Vitalis studio here, and I have our first guest here, Mr. Dr. Johan Grub. How has your day been here?
Thanks, Mika. It's been great. Love being here. Good talks, very interesting things going on in the sector.
And I understood that you had a presentation here yesterday too. What was it all about then?
Yeah, so I had the opportunity to talk about Flowful, an approach which is about rethinking the way we approach improving patient flow. The idea is to find the smallest changes that will have the greatest benefits across all patient flows, so all patient pathways. So instead of trying to improve everything everywhere, we realized that there's actually very few things that determine the performance or the flows throughout a hospital. And so we identify those and focus improving those, and that can allow you to shorten the lengths of stays very quickly. So for instance, in a recent case in the UK, we reduced length of stay by 16% in a matter of 10 weeks just by focus. So the thing is like very surprisingly small changes that can have a big effect, but if you just need to focus.
Sounds really interesting. What was the response from the audience?
They were great. Unfortunately, there wasn't a lot of time to engage in a discussion, but you could definitely see how people nodding and great feedback afterwards. So yeah, it was a good experience overall.
How long are you staying here? Can people come and see you here in NHG's amazing booth?
Absolutely, I'll be here till the end. So what's that? Today's Wednesday. So today and whole of tomorrow I'll be here. So please come and say hi.
Thank you, Johan. Thank you.
Hello and welcome to Nordic Healthcare Group's studio. I am here with Magnus. Magnus, can you tell a little bit about yourself and this cool game that we have here?
Yes, my name is Magnus. I'm a nurse in anesthesia and I'm working at Nordic Healthcare Group. And one of my specialities is to enlighten and give new insights about improving processes in the healthcare system. And that is why I brought these buttons. So we shall play a game now and hope you will understand. So we start doing this. You get one pile of buttons and I get one pile of buttons. And I do like this. I don't see your buttons and you don't see mine. So the instruction is sort and prioritize the buttons. That is the instruction. Okay?
Okay,
Let's do it.
let's do it. Nice dots. Okay, I'm done.
I'm soon done.
Okay, now you have to explain more.
Yes. So what are these buttons represent? These buttons represent either people, patients, IT systems, strategy, workflow, guidelines, anything that you have in a complex environment like hospitals. And if I am the CEO, you are the CEO in a hospital, I'm a nurse, and you are looking in a specific IT system to check that the hospital is running good. But that IT system I also have access to and I need to input some data. But it's not interested for me because I don't prioritize it. I have other system I need to prioritize. So if I'm bad at input data, you get the wrong results. So how we look and sort and prioritize is quite different. So how would you know how I prioritize, and how would I know how you do it? That is all about communication. And when you have a barrier like this, you see that I prioritize differently than you. So what do you say? Why did you sort and prioritize like this?
My plan was to sort them by the sizes. So, and in different groups.
Yeah.
So if this would maybe be a hospital, I would maybe sort them by different teams, for example, depending on what sickness there are. So that was actually my plan with this.
And I had a different approach. I worked in flows, so I have streamlined the flows. But there are some similarities that, like the big buttons, are in the same. So we have some similarities, but we are also very different. So how to be in the same content and consent, we need to talk to each other, top management and the workers, the key workers, for example, in a hospital. And this is one way to show that it's very difficult if you don't talk to each other. So, hi,
Let's talk.
let's talk.
Hello and welcome to NHG studio again. I have our next guest here. Hello, nice to meet you. Who are you?
My name is Tommy Wallström, and I'm the head of our solutions business at NHG.
I heard that you are a master in dental care. What does that really mean to you?
Um, my there's really good dental team that we have at NHG, and they are working hard. Cannot claim that I'm really the true master of dental care, but we are providing a dental quality and outcome metrics for the dental care, and that's a nice dashboard that is used really widely in Finland in the public sector. About 75% of the Finnish areas are participating to that or have that product for their BI and management purposes.
Did you say 75%?
75%, yes. So almost all.
And what do they gain from it?
They understand better what's their clinical quality, and they can manage how to improve that. For example, there's a periodontal care, which is the kind of the two major illnesses in the each mouth. There's a kind of caries and the periodontitis, and periodontitis is really underdiagnosed in globally actually, and we have a metrics how to kind of how that diagnosis is done and it's that, for example, one key metric how to kind of improve your dental care quality. If you measure it, if you diagnose it and you know that you are diagnosed it, then you can change things. But if you don't, you don't have that possibility. So, and I think that has a huge impact to the kind of overall health of our Finnish population.
And you will be found here for more discussion in our booth here in Vitalis. How long are you staying here?
I'm here today, Wednesday, and tomorrow for the whole day. So you find me at the NHG booth.
And I heard that you have really good coffee here too. Is that right?
Yeah, that's true. We have true barista here. So come over for espresso or cafe latte or everything. So
Okay.
and have a nice discussion meanwhile.
Thank you very much, Tommy.
Thank you, Mika.
Hello again. It's NHG studio straight from Vitalis again, and I have my colleague Anna Karlberg here. Hello, Anna. How are you doing?
I'm Good. Hello. How are you?
Very well, thank you. How was the last night at the dinner party?
I came in a bit late because I wasn't here for the dinner, but you guys seemed to be having fun when I arrived, so that was fun.
It was, yes.
You?
You also gave a presentation today in the. What was it all about? Can you tell a bit about it?
It was about data-driven operational development, but with the twist of using um, experiences and knowledge from the healthcare professionals. So, so basically turning data into excellence, but also vice versa. So, talking a bit more about how data can be used to create excellence, but also the other way around. So we don't have data unless we have excellence.
Well, why did you choose that topic? Why do you feel it's important to talk about this?
Because we talk about a lot about digitalization and using data in different ways, but what I feel is missing is the perspectives of the healthcare professionals who actually work at the hospitals or the healthcare system. And we also talk a lot about patient centricity, but
Yeah.
for a healthcare professional, that is a given. So we're actually there for the patient, so we don't have to focus on them that much. I think we need to also include them, of course, but remember to use the healthcare professionals' experiences and excellences.
Sounds interesting. What are your expectations for today?
I think I think we have a lot of people here, a lot of people who want to know more about us and what we do. So just to meet a lot of people and spread the message.
Just one more question. You have a location in Stockholm, isn't that right?
Yes, we did.
What kind of office and how many people they are working there as your colleagues?
We have around 10 people working in the Stockholm office at the moment, and then we also have an office up in Piteå, where we have one consultant.
Excellent. Thank you, Anna. It was nice to have you here in our amazing NHG studio.
Thank you.
Please welcome to NHG Vitalis studio again. And this time this is our final session actually. We have Jessica here, my colleague from our Swedish office from Stockholm. Hi, Jessica.
Hi, Mika.
How is it going?
Good. Tired after 3 days here, but it's been really exciting to be here.
I noticed that you arrived here already on Monday because you have been setting up our booth here and organizing our people participating this event. How has it been like?
Good. It was a good thing we came down on Monday and that me was here with me because she got people, painting the booth and doing the last details. So it's been really looking sharp. But the people has been, you guys have been good. You've been working in the booth, you've been staying here, you've been following the directions now.
That's good to hear. There were quite many people from NHG here. How many there were visiting this year?
I think we were 25, actually, in total. And maximum, we were 14 people here on Wednesday at once.
That's great. What kind of discussions and what kind of topics have you had with your customers and people meeting here? What kind of topics have raised there?
So it depends. The Finnish people coming by have been looking at us and saying, "What are you guys doing here? You're Finnish? Are you in Sweden now?" Which is really fun because that's sort of the idea of being here and trying to say, "Hello, Sweden. We're actually also have a presence here." And the Swedes have been wondering who we are, really, and what we do. I've been talking quite a lot about, of course, the EMR implementations going on. Being also in VGR, that's a big question here with the Millennium. But also, there's about 11 different regions in Sweden currently implementing new EMR systems. So that's also a big topic in different areas.
Are there some tips to take home or some ideas you will continue working on after this seminar?
Yeah, I think a lot of clients are looking into market access, basically, both into the Nordics. And as we have the presence in Sweden and Finland and Denmark, of course, we can actually help them out and try to also, how do you say, translate what that would mean. For example, a Swedish company wanting to go to Finland, we can actually help out with translation and everything what that would mean.
Now, once you have been working quite the time already with your Danish colleagues and your Finnish colleagues, how does it feel like being part of this community?
No, I like it. I like it as well. One of the best parts of being here is actually meeting you guys in real life and being able to sit down, have a drink, and laugh about our differences and getting to know each other better and our cultures. So that's been really inspiring for me as well.
It's been really inspiring to us also, and it's been really enjoyable visit here for us too. And this is quite an interesting event, and quite many people attending here. Do you have any idea how many people there were here totally this year? Thousands and
I don't know actually. I know some people said there was a bit fewer people this year than last year, but I don't know. I haven't been here before, but I don't know the number actually.
So this was your first time here.
Yeah, it was.
What about next year? Are you gonna be here?
That's the plan. Given that we can, keep growing our presence in Sweden, that's the idea, to come back as well. It's been really good discussions, really.
Are you going to invite us here to next year?
The Finns, you mean?
Yeah.
No, by then we have enough Swedish people. We don't need. No, of course, yeah. I mean, it's really interesting as well to have the discussions when it comes to the EHGS regulations, for example, where Finland is also, I have to say, a bit before us in that area in Sweden. So it's really good to be able to bring in that knowledge that we have from Finland and that experience. So, yeah.
So Nordic cooperation will continue.
I really hope so. That's why I'm here. So.
Thank you very much, Jessica.
Thank you, Mika.
Thanks, and greetings from NHG Vitalis studio.